If you experience any kind of pain or inflammation, you may want to listen in on the next few minutes because I'm going to share with you a drug-free alternative being used more and more by the medical community. Hi, this is Dr. Mario Mancini, the Medical Director of the Center for Integrative Care, a functional medicine and peak performance center here in San Diego. You know what's interesting? Over 85% of referrals to our center for pain and inflammatory conditions come from medical doctors. Why? Because what they are now seeing is not only research supporting it, but more and more patients wanting this alternative to medication. This drug-free alternative is biomedically based acupuncture. So what I'm going to briefly explain is how biomedical acupuncture helps reduce pain and inflammatory conditions. Now I want to start off with one basic premise, and that is, the body has an amazing ability to heal. You don't need to tell your body to heal. The only time it does not heal is when there's some type of interference with that self-healing process. When the body does not heal or goes beyond normal healing time, the system starts to become faulty. And when that occurs, the body goes into self-protection mode, causing it to get stuck in a chronic state of pain and inflammation. Now remember, the body would never do anything to harm itself. It's doing it to self-protect. Now I know you're thinking, no, my body is trying to kill me. It hates me. I understand your suffering and it's affecting your life. But you have to realize that the system is faulty and it's creating its own demise, causing the system to generate more and more pain. The bigger problem here is that it gets stuck in a pattern, adapting to the condition, learning to live with it. When that happens, the body no longer prioritizes the condition, therefore becomes chronic. This is where biomedical acupuncture has a profound effect. Why? Because it turns on the body's highest priority system. It's called the blood clotting system. Now this system is more important than any system when it comes to survival. Why? Well, think about it. If you had a paper cut and you didn't have the ability to clot, what do you think would happen? That's right, you'd keep bleeding. Now the Chinese figured out over 3,000 years ago how to bypass the system without causing a bleeding effect, but still turning on this high priority system the same. Now in our office over the past 18 years, I've seen patients on Coumadin, warfarin, Plavix, blood thinners, and I've never seen a difference. Why? Because the needles are hair thin. So when we do that, we turn on this heightened response. The body goes, whoop, what in the world just penetrated the borders? The skin. Now realize, when you insert the point, we are also causing a micro trauma. That's right, a little tiny minute trauma. Not visible to the eyes, but under a microscope you can see this. When that happens, the body will not only see this as a high priority to the location to self-protect, but it also begins to self-repair at a high rate, kind of like an emergency rehab crew, because the body believes it's a new injury. Now here's the key. The body does not know the difference between the minute trauma that we created and the old injury. So guess what it does? That's right, it drives high amount of blood flow into the entire area. So what we're simply doing is we're tricking and triggering the brain and nervous system to take high amounts of blood flow and drive it into the entire area. Now when you move more blood into any area of the body, you will increase the probability to heal exponentially. Why? Because the blood contains all the vital substances of oxygen, nutrients, hormones, and immunological substances for self-repair. Now an interesting thing that I have seen over the years is as we increase self-repair, the need for medication is reduced. Why? Because the body's working more effectively in the area of trauma. So what happens? The medications become more effective. So when the medications become more effective, guess what happens? You don't need as much. So what biomedical acupuncture does not do is simply numb the area. It doesn't just turn off the alarm systems. It turns on self-repair in the region, and when that happens, your pain goes down because the area is literally healing. Your function goes up, which is really the key here, ladies and gentlemen. It's not just about getting out of pain. Medications are powerful for that. It's really about improving the quality of your life. And lastly, the need for medication reduces. This is what we often see when we utilize biomedical acupuncture for pain and inflammation. If you'd like to find out more about how we can assist you with your specific health concern and how we can best integrate the use of biomedical acupuncture along with your current health care in a safe and effective way, contact our office to schedule a free consultation with one of our functional medicine specialists where they can answer any questions you have to find out if and how we can help you with your healthcare needs. I'm Dr. Mario Mancini, and I wish you the best.